So we spoke about the indicators. We do have some generic indicators. However, indicators are developed and evolved over the time based on the circumstances in a specific context. We have discussed about the early preliminary identification process as well as the formal official identification process. And now we're going to see what are the methods available to us in order to identify the victims of torture, or in order for us to really collect information and look into the signs and the red flags and the different indicators. There are three proposed, let's say, methodologies: observation, review of institutional records, and an interview with the potential victim. I will focus on the observation as well as the interview process. I will not discuss in details the review of institutional records. First of all, because institutional records might not be available to all of us. Institutional records are protected by confidentiality, and therefore not everybody has access to them. However, if you do have access as a result of your profession or your status or your role, then institutional records can also be revised. Institutional records refer to case files or registration forms or any information that you might have from previous interaction or previous interview. That could be an assessment or the asylum interview or the registration process. But given that we are mostly, our main ways to assess is through observation and through interview, I will not focus too much on the review of the institutional records, but I would like you to be aware that this is also a way to assess signs and to identify red flags when it comes to trafficking. Revision of previous records, which again are not always accessible to everyone. So observation is the process by which the first responder focuses attention on observable behaviors, like kind of obvious, let's say, behaviors, attitudes, and elements. This could be attitudes of the person or information which are directly shared by the individual. This information could be also requests for assistance and support. If someone needs like healthcare services, during the examination, you can also observe specific red flags, specific indicators that have to do with the physical appearance, for example, or the emotional, psychological state of someone. So observation is something that occurs usually when we first contact the person at reception centers, or when the person seeks support from NGOs, when the person engages in safe space activities, in distribution points, during the interview process. However, observation can also take place in different stages, in shelters where people are accommodated for rehabilitation purposes, in safe shelters upon a GBV incident. Observation can occur in different periods of time. However, it mostly occurs at the first time we interact with the potential trafficking victim. What we observe, as we mentioned before, physical characteristics, whether someone is hurt, whether someone is injured, potentially someone's look, someone's clothes. These do not necessarily lead to identification of trafficking victim. However, combining these elements with other elements might raise suspicions. We observe whether the person is alerted and is aware, emotionally aware, situationally aware, where the person is able to respond, to interact with us as expected. What is his attitude towards the interviewer? Does the person show frustration? Does the person show mistrust? Is the person stressed? Does he or she express any emotions of fear, or does he look afraid? Whether the person comprehends the conversation and the discussion, if the person is nervous. And we can often observe symptoms related to alcohol abuse or abuse of drugs and other substances. The person might have symptoms of drug abuse or substance withdrawal. Often people are given like substances before the exploitation incident occurs in order for them either not to resist or to feel like better, to feel more alert, let's say, and therefore these symptoms might be quite obvious when we interact with someone. Once and if we have enough elements through our observation, or if we have enough red flags, enough suspicions, then we could potentially move and conduct an interview. The interview might be conducted by specialized staff, which is the recommended process. People who are assigned and mandated to conduct this type of interviews. And this falls under the formal identification process, as we have already described and mentioned. However, often these type of incidents might be disclosed during an interview or during a session, during a discussion that occurs for other reasons. Either because the person is already part of the case management. Alexandra gave an example before of a girl who was already receiving services as a GBV survivor. And disclosure might occur during this type of services, this type of interview, in a hospital, in a clinic, when persons seek for medical care, medical support, during a session with a psychologist, with a psychiatrist, or even during a session with a lawyer. There are 3 steps during this interview process: the preparation for the interview, the process during the interview, as well as the closure. And there are specific guidelines for every single part of the interview process. Overall guidelines and overall issues that we always need to keep in mind, not only when we have interviews and discussions with trafficking victims, but when we do have discussions with people at risk and sensitive cases. Again, during the preparation phase, really assess yourself and also your colleagues and discuss with them who is the most appropriate person to conduct the interview. Maybe you need to take into consideration elements of gender, elements of related to the language, or even the origin of the person, or the age. Clearly, technical skills and competences play a key role, but also the fact that you might need to have an additional person to interpret for you could be a factor that you might want to avoid. When there is a third person in the room, always seek consent from the interviewee, who is going to trust you and share with you potentially confidential information and sensitive information. Other skills needed, of course, for an interview process is empathy, being able to actively listen without making any judgments, but also show respect on what the person wants to share with you. Do not try to push people and do not try to really investigate further than what the person wants and is willing to share with you. Of course, keep your neutrality. Ask questions which are relevant to the interview and to the information you want to collect. Don't ask irrelevant questions. Try to be as focused as possible, and also try to repeat what the person has shared with you in order to make sure that you have understood correctly and eliminate the risk of making assumptions. Be prepared in the terms of having a clear set of questions. Of course, have your forms ready, be able have your laptop ready, or your pen and pencil, whatever you are going to use. Keep your phones silent so that you don't interrupt the interview. Avoid becoming personally engaged. Make sure that you are able to maintain boundaries in the conversation for your own sake and for your own protection, but also because you want to protect the person by not creating this illusion that you could potentially provide additional support than the support you can actually provide. So don't make sure that you don't raise expectations, and be very clear and very specific on the purpose of the interview and what kind of services you can or you cannot provide. Something that you really need to keep in mind is that the person who has suffered any type of violence, and in particular trafficking, sexual exploitation, or labor exploitation, might be still suffering from trauma, either physically or mentally and emotionally. So sometimes the person might show signs of distress, which is completely understood. Might also show signs of mistrust. Therefore, you really need to be very tolerant and patient, show empathy, and be able to understand and reassure the person you have in front of you. It might need time. It might need from your side to repeat the same questions using different words, and check again and again on whether the person really understands, has the mental and emotional is in the mental and emotional state to really understand the question. Show a lot of empathy and patience. And take regular breaks. These conversations could be extremely lengthy. Therefore, the person might get distracted, tired, might not be able to focus and concentrate, and might not be able to give you the answers you expect. Don't put pressure. It's better if you give time, you take a break, you come back, you resume the conversation, than putting pressure on the potential victim. Something that has been regularly reported is that people feel complete mistrust. They don't want to open up, especially after an incident of trafficking, and they don't want to open up to authorities and professionals and NGO staff, because although you have already explained that you are there to support and to help and provide services, information, and protection, very similar promises have already been made by the alleged traffickers. This is one of the reasons why people show this mistrust to you, although you do express your willingness to support, help, and provide protection services. If we go back and we reflect on the example of Lisa, the boyfriend, had promised her to help her with her studies, to help her pursue her dreams, to help her get away of a situation, her family basically, where she wasn't feeling comfortable and happy. So our role is really to try to build the confidence and give people reassurances until they feel comfortable enough to share with them. And we do that by being honest and by not making false promises or unrealistic promises. Something that is also very important and creates this environment of reassurances is that we have done our homework. We are fully aware of the referral systems and the assistance that it is available either through our organization or through other organizations. So be fully aware of the available services and the referral pathways, the referral mechanisms, so that we can provide accurate information in a language the person understands, and make explain to the person that the referral process, so that he or she can consent on being referred to other service providers. Information, of course, is key on rights and entitlements. And again, this is up to us to be able to have clear and accurate information so that we can communicate in a way that the person understands. Sorry. Yes. So this is also part of the closure of the case. When we seek consent, most of you already have experience with assessments, data collection, and referral procedures. So you know very well that often we seek for written consent as well as informed consent. Informed consent is given only when the person fully understands and is aware of the purpose of the data collection and the purpose of the interview. We follow a survivor-centered approach. Access to services depends on the needs and wishes of the survivor or potential victim of trafficking. We follow referral pathways established at field level upon seeking consent. We either provide direct services or we refer to a service provider in a safe and dignified manner. Always be aware of the focal points in each location or area of operation. There are specialized staff, especially in reception facilities, who are mandated to conduct screening interviews. They are in charge of detection of victims of trafficking. Even if the trafficking victim doesn't want to go through the formal process, this staff might be able to assist you and guide you in order to avoid exposing this person to further risk and further harm. In case of self-identification or in case the victim of trafficking consents to be referred to a formal mechanism, follow the referral pathways. Again, there are specialized actors, reception staff, potentially EOD, social workers, psychologists who are assigned to perform screening interviews. If there is no referral pathway available, support the victim of trafficking to report the incident to the police. Contact either the local police or the anti-trafficking unit, and I am going to share the phones with you in a bit. Or support the victim to reach to a specialized actor. You can do that through accompaniments. You can do that through provision of interpretation services if there is no other interpreter available. You can also accompany with a social worker or a protection staff or a non-protection staff that has already developed this relationship. The person who is engaged, for example, in the preliminary identification can also support, accompany, and help the victim of trafficking to reach out to the specialized actor or the actor who is in charge of the formal identification interview process, etc. And of course, if the victim consents, you can refer directly to the anti-trafficking agency, the anti-trafficking unit of the Hellenic police, where there is specialized staff fully trained to perform this type of interviews, and works, of course, closely with the prosecutor. What I have highlighted here is that even if the victim of trafficking is not, doesn't consent to go through an official identification process, actors may also refer or report the incident of trafficking to the relevant authorities. Trafficking in Greece is a prosecuted crime. Therefore, the prosecutor can order a formal investigation without necessarily the consent of the victim of trafficking. That also means that the victim of trafficking is not obliged to collaborate with the authorities. He or she can access protection services, and the prosecutor can at the same time order a formal investigation. Hotlines which might be useful in your day-to-day work. We have the 821 hotline, which provides, in addition to consultation information, also interpretation. Therefore, the hotline can be reached either by people at risk of being trafficked or victims of trafficking, as well as by employees, NGO staff, different professionals who might want to report, refer a case, or seek support on how to address a trafficking incident. We have the National Center for Social Solidarity, ECA. Under ECA, we have the national referral mechanism I'm going to refer in a bit, and there are two lines. One line for child protection, not targeting trafficking incidents exclusively, but all child protection incidents. And we have the direct social aid line. Then there is a 15900 for incidents of violence against women, including trafficking, where again victims, survivors, as well as staff can call and seek support, assistance, information, and guidance. And the phone numbers of the anti-trafficking units in the police department of Athens and Thessaloniki.